illness. Now, to discuss this new COVID strain that's entering the United States is Dr. Virginia Bieluch, Chief of Infectious Diseases at the Hospital of Central Connecticut. Thanks so much for joining us right now to talk. So we're talking about 2 confirmed cases. Now, what do you want people to know about this new variant of COVID?
Well, first of all, it's not surprising that there are new variants. Viruses make mistakes when they replicate themselves all the time, and the vast majority of these we don't even know about. So this is a normal biologic behavior on the part of the virus. I think it's important for your audience to know that the things that we're recommending, such as wearing masks, social distancing, hand washing, hand hygiene, are going to work for this virus. So it's very important to continue these measures to protect yourself from getting the virus. Thus far, although the virus seems to transmit more effectively, there's no evidence that it causes more severe disease or leads to increased death rates.
Okay, now with those 2 confirmed cases and other cases suspected, do you believe we could expect to see a lot more of this in the coming month or so?
It's certainly possible that there are more cases around that haven't been identified. Only a small fraction of COVID viruses from people are actually sent to laboratories where they look at the genetic makeup of the viruses. So we don't know how widespread this is in the country yet.
Interesting. Okay, that was actually my next question, is how they are finding this different variant. So if someone goes down and gets a COVID test right now, there's no guarantee that they're going to know which variant they have?
That is correct. Again, it's a small fraction of virus samples that are actually sent to the specialized laboratories where they can look and see if there are changes. My understanding, though, is that they're going to step up efforts and increase the number of viruses that they're going to look at the genetic makeup of. But again, it's going to be a small fraction of viruses. So clinically, it really thus far doesn't make any difference which variant you have. And I think we all need to continue to practice the things that we've been recommending, such as mask wearing and physical distancing.
Okay, and we're learning more and more about the vaccines every day. But so far, what do we know about how it stacks up to this variant?
Really good question, really important question, something that scientists are actively looking at. When we get the vaccine, we actually make a number of different antibodies. So it's believed that the virus would have to change in many different ways for it to evade the vaccine response totally. Thus far, there's no evidence that the vaccine will not be effective against this variant of COVID-19. But again, it's going to take some time to sort this out.
All right. Dr. Virginia Bieluch, thank you so much for taking the time to join us.
Good evening and Happy New Year.
You as well.